This is Dr. Ben Thompson and Dr. Ramsey Poindexter here with Treble Health. We're going to talk about how to reduce tinnitus through sound therapy, one of our favorite subjects. If you're watching this live, let us know in the chat because we will be responding and answering your questions. If you're watching this on the recording, feel free to check the timestamps below to jump around to your favorite sections. Dr. Ramsey, how are you doing today? Tell us about the conversations you've been having with some of your telehealth patients around sound therapy.
I'm doing really well, Ben. Thank you for asking. Um, Sound therapy is something that I talk about all day long with patients because, as we know, it's a therapeutic approach for tinnitus. It's a pathway for habituation, and I think a lot of our listeners have heard that word habituation, are very familiar with what that means. But bottom line is getting the tinnitus to be less bothersome, less of an annoyance, get it into the background, reduce volume, all of those things. And the use of sound therapy is a direct route to accomplish that. Mm-hmm.
Hello, Donnie. Nice to see you here. So, Dr. Ramsey, do any cases come to mind? Patients that you've been talking to recently? Let's start with some advanced. What I like to say sometimes is, money aside, just from our recommendation, what is the best sound therapy treatment? What is the best sound therapy protocol? Let's say that I have
Sure.
a mild high pitch hearing loss. If you could give me the best that's out there, how would you approach that with sound therapy treatment?
So the gold standard for sound therapy would be something ear level, right? So pending that can be accomplished two ways. If there's a hearing loss, then we can accomplish that through a hearing device. We call them combo units, where they provide amplification for the hearing loss as well as programs for the tinnitus. Or if there's not no hearing loss present, then we can use an ear level sound generator that's just providing sound. And why that's kind of the gold standard is we have a lot of control when we fit things at ear level. We're able to control the sound. It's a continuous, it's a stable environment. It's probably the best way to deliver sound therapy. Like you said, if there's no financial concerns, that would be the gold standard of how to do it, because it's very continuous and we have so much control. And the way that we can set it can be very appropriate for the patient, because sound therapy is very tricky. You don't,
Hmm.
in terms of volumes, and we want to really control what we're giving the auditory system, and sound and ear level devices allow us that ability for control.
Yeah, absolutely. And for those of us who are here live, welcome. We see William, Shalma Meadow, and a few more here in the live chat. We are referencing tinnitus sound therapy, and this is coming from a 2022 tinnitus guide that our team of audiologists put together with Treble Health. And the purpose of the guide is to walk us through the newest tinnitus treatments and the management tips that we're going to recommend this year, 2022. Our hope is that this is the year that tinnitus can go from an issue to a non-issue in your life. And we're going to drop the link to download this guide so you can read it and print it, have it on your own as a resource. Let's continue on of explaining and answering a few questions. All right. First question is coming from William. William asks, is sound therapy used to speed up habituation? And William says that CBT worked for him. What do you think, Dr. Ramsey? Is sound therapy used to speed up habituation?
We know that the use of, and I'm happy to hear about the CBT. That is very useful. We know that sound therapy in combination with other approaches. So we don't always just want to focus on sound with tinnitus patients. We want to focus on things like CBT, coping strategies, good sleep, mindful of stress and anxiety. It's a holistic approach. But if we do all of it together, combine a good sound therapeutic approach, that's probably the best package we can provide for habituation.
Yeah, so we want to do both. And sometimes patients
Mhm.
struggle because they're wondering, should I do CBT? Should I do mindfulness? Should I do TRT? Should I use sound therapy? Which one should I
Mhm.
choose? And usually it's a combination of
It's a
some
combination.
psychological, aid,
Mhm.
which you can get from different professionals, does not necessarily have to be a licensed psychologist, but some form of reducing anxiety, stress, improving sleep. And then the sound
Sure.
therapy part of it, which is where we really shine as audiologists, and I'm proud of that. I know the sound therapy helps. I hear it all the time, and it's not just a coping mechanism. It helps make habituation easier. It helps
Mhm.
make it happen as quickly as possible. So, can it speed up habituation? I'm not sure if it can speed it up, but it certainly allows it to happen, all things equal. So it does
It's
help,
it's it's part of the big picture for sure.
definitely. So as we're mentioning, we do have different management tips, different treatment techniques. You can check some of those out in the tinnitus guide. Dr. Ramsey, take the floor.
Yeah, I just wanted to add one thing that might go along those lines. One of the things for sound therapy is it does take the edge off, which I think is really useful too. So, like Ben's saying, a combination of everything is super important. Will that get you to the end goal any faster? We don't know, but it is another way to help reduce the stresses around the anxiety, or excuse me, the stresses around the tinnitus. And um, um, like I tell patients a lot of times, it helps take the edge. The shoulders are up here sometimes when we're listening to our tinnitus, but for me, for example, when I put my sound generators in, my shoulders just drop. It just really does relieve some of that tension and take the edge off.
Mm. And let's ask a question here from Meadow. Dr. Ramsey, will sound therapy work for tinnitus that was caused by ototoxic drugs?
Yeah, regardless of how your tinnitus, how you, wherever the tinnitus came from, the treatment mythologies are still going to be the same. We still want to approach it from all different angles, right? So just like anything that comes up, whether any disease within the body, we never focus on just one treatment. We want to focus on a little bit of everything. So tinnitus retraining therapy has different modalities that we use to treat it, and regardless of where it came from. So if it's ototoxicity, we would still apply the same methods.
So, for those listening, you can speak to Dr. Ramsey. You can speak to myself if you reach out to us through Treble Health. We're here and happily answering some questions on this live stream. Question from Steph. How's it going, Steph? Do
Mhm.
you need hearing aids for sound therapy, or can you just play sounds on earbuds? Well, I would recommend hearing aids or tinnitus maskers, also called sound generators. If you want a personalized recommendation for that, reach out to our team. We'll understand your history and be able to better serve you. Earbuds are better than nothing, but earbuds are not even close to as beneficial as hearing aids or tinnitus maskers. I would say somewhere in the middle would be bone conduction headphones, as that's a step up from earbuds. And depending on your budget, depending on how seriously you want to approach tinnitus treatment, you might choose one of those levels of sound therapy. Earbuds, they help some, and they're not our go-to, but as I said, better than nothing. Okay. All right, we have some more live questions. Shalma, nice to see you here. Shalma from Facebook asks, will sound therapy for tinnitus reduce the volume of the sound?
Do you want me to start with that one?
Yeah, please go ahead.
Um,
I'll ask again so we can use it for a
Yeah, I
clip
mean, we
later.
both probably should comment on this question. That is a good question. Oftentimes, it's a long process. So keep that in mind. These kinds of changes don't happen overnight. It can take upwards to a year for some patients. Some patients it takes less. Often the first things that we start to see with our patients is that the tinnitus just overall becomes less bothersome. It's less of annoyance. It's less affecting daily activity, life, etc. That tends to sort of start to resolve first. And then I start to see that the volume comes later. That's my experience. I'd be interested to hear what Dr. Thompson's report would be, but typically I see the volume as the last step when we're treating our tinnitus patients. I'll give you an example. Today, I've been seeing patients all day, and their volume might be the same as when I saw them, say, a month ago, but they're less bothered, they're less annoyed, they're not noticing their tinnitus as much throughout the day. In fact, that can drastically change, but the volume might still be there if they actively have to focus and sit and listen. So, but often the volume will improve over time. So that's been my experience. I'd be interested to hear what Dr. Thompson has to say.
Yeah, the good thing is that tinnitus volume can reduce, and it's a medical condition that's different than most, where it takes a lot of time.
Mm-hmm.
I agree with you, Dr. Ramsey, that first, the awareness or the annoyance of tinnitus is defocused from the brain. It's improved.
Mm-hmm.
And when that happens, that's setting it up so that the volume can reduce, but not always. So sound therapy helps habituation. Habituation happens in the brain,
Mm-hmm.
and oftentimes the sound gets softer through habituation. So you could use the transitive property there and say sound therapy helps habituation, and habituation can reduce the volume. So if you wanted to do everything you can to help tinnitus, we would say follow a sound therapy protocol, work with a good audiologist who can help you through that. Don't try to do it yourself by using headphones or here and there. Really
Mm-hmm.
commit to something and use it long term along with some other tools. And that's what we see as working. As I was describing earlier, this tinnitus guide that we created, the 2022 tinnitus guide, it covers sound therapy and other techniques and methods. So what we do is we use all of them. We use anything we can that's shown to clinically improve tinnitus, sound therapy being one of them. Thank you, Shalma, for the question. Dr.
Mm-hmm.
Ramsey, from some cases you saw today,
Mm-hmm.
what were some questions that patients may have asked, or maybe some insights you have from people you have helped today about how
Yeah,
to use sound therapy in their life?
sure. I think one of the biggest questions I get asked most often is has to do with the volume. So we really want to focus on. They ask, how loud should the sound therapy be? Do I want to mask my tinnitus? Do I want to, that's a common question. And then another common question is what should the sound source be? So those are the two biggest things that I get asked. Yeah.
Mm.
Um, I can. Do you want me to elaborate on those answers or?
Yes, please.
Yeah, okay. So as far as the volume, the goal is we don't want to mask our tinnitus. We want our tinnitus to be there. We want our brain to know it's there, because that's how it's going to get to the other side, to get to the point of where our reaction to our tinnitus is less. It's less bothersome, it's less annoying. So you do want the brain to know the tinnitus is there. That is important. So you never want to mask it. When you're using your sound therapy, you want to find a volume that's sort of like at a mixing point of your tinnitus, so that you can you'll still be able to hear the tinnitus, but the sound that you're playing is just below that. So you're still able to concentrate and focus in on what it is that you're trying to attend to, whether you're, at work or, I have patients that wear sound in their ears while they're watching television or, actively working. It's something that's going on very softly in the background. Okay. So you never want to overdo the sound. As far as what kinds of sounds, we often recommend whatever is comfortable and soothing, whether that's a white noise, a pink noise, crickets, oceans, whatever is comfortable. We want it to be kind of this repetitive, in the background, consistent sound, but something that's calming to the nervous system. So it doesn't, a lot of patients try to match their tinnitus or try to find that frequency. That's less important as to finding something that's calming.
Totally agree. We have a very good question here from Star
Okay.
Fox, who
Sure.
asks, is sound therapy something you do temporarily until you retrain your brain and habituate, or is it something you have to actively practice the rest of your life?
Is this for me? Should I
Yes,
just keep
please
going?
go ahead.
Okay, let me just keep going. No, you don't necessarily have to participate in sound therapy forever. You like habituation with tinnitus can happen in 3 months, 6 months, 9 months, sometimes a year. It's very subjective and it's very patient dependent. Once patients have reached a point where they feel their tinnitus is less annoying, it's less bothersome, it's not affecting their daily lives, they're not as stressed or anxious about it. Once that's reached, oftentimes we can stay there. It's normal to have spikes here and there after habituation has been reached. Sometimes we have to dig back into our toolkit and do all the things that we were doing, whether it was, being mindful, meditating, and using sound therapy. Sometimes we have to dig back down and calm spikes that can occur. That is normal, but usually once you're reached a good point, you can stay there for a long, quite some time.
I
Dr.
totally
Thompson,
agree.
do you agree?
I totally agree. It's a great question, and
Mm-hmm.
it's helpful to know. Oh, okay. So, sound therapy is used during this retraining period, but it's not a forever thing that I have to rely on. And I use the
Right.
analogy of when I break my wrist, I need to wear a cast for a period of time in order for my body to naturally heal. The cast is not resetting the bone. Really, the bone heals by itself through the intelligence of the body, and habituation to tinnitus occurs through the intelligence of the body. We're just directing the course of it, creating a container, creating tools, and setting it up so it can happen without interference, without psychological blocks or negative loops, etc.
Mm-hmm.
So, really important question. And yes, after you're done, no, you don't need to wear the tinnitus maskers because you're not bothered by it. Sure, you can keep them, use them as needed.
Right.
Next question we'll do real quick is from John. John asks, do any of the Zen acoustic neuromodulation audio sounds help as therapy or a cure? If you're talking, so Zen tones and some neuromodulation can help. It's not something that's recommended as a primary approach to tinnitus. It's a form of sound therapy, and our advice generally is not to hyper focus on trying to get the perfect sound therapy with certain frequencies, because usually what's best is something like a pink noise or something that's general, or crickets, something that's general as opposed to a specific approach. For example, Zen tones by the hearing aid company Widex, they can be helpful, but not everyone likes them. Not everyone responds to them. So you have to respond based on what's working for you. Respond based on what gives a positive or a neutral feeling. Uh, I'm going to jump into the next one, and Ramsey, we can tackle this together.
Okay.
Okay, Kevin, nice to see you here. Kevin asks, can I use the Bluetooth through hearing aids as sound therapy if the hearing aids don't have the maskers built into them? This is something that one might run into if they go to get hearing aids through Costco, for example, that sometimes the clinic says, look, I can't set up tinnitus for you, but there is Bluetooth. So, Dr. Ramsey, how would you use hearing aids for tinnitus sound therapy in that situation?
Yeah, sure. This came up about a half an hour ago for me and a patient. He has hearing devices. They are Bluetooth compatible. So we figured out apps that he could download and play his sound therapy through his hearing devices. So there, that is possible. Yes.
Agreed. So the Bluetooth can be used, and that's a good option.
Mm-hmm.
Especially if you're someone who's on their phone or has their phone around a lot, then it shouldn't be too big of an issue for you to use the Bluetooth for the sound therapy.
Mm-hmm.
Um, all right. Another great question, which asks, does an increase in volume or perception of tinnitus always correlate with some degree of adverse mental reaction to it? Can a fully habituated person notice an increase due to anatomical changes? I have some answers. I have some thoughts on this. Some medical conditions leading to changes in tinnitus come to mind. Dr. Ramsey, would you like to start with how can tinnitus change in the ear, in the physical structures?
I think I'm gonna let you answer this one.
Okay.
Yeah.
Where I was thinking was, if I have earwax clogging my ear, if
Mm-hmm.
I have an ear infection or fluid behind the eardrum,
Mm-hmm.
then that
Okay.
can create an increase in the volume and perception of tinnitus. And if I have a sudden hearing loss, that immediate change is going to be noticed by the brain. And oftentimes, people who have a sudden change in hearing notice a change in tinnitus or an onset of
Mm-hmm.
tinnitus.
Okay.
So that is completely independent from a mental reaction to it. Now, separately from that, certain things can happen past the cochlea, right? Related to the limbic system, the brain, the psychology, the how the brain and the nerve is wired. That is more likely to be affected by mental reactions, psychological state. But to answer your question, there are certainly real physical explanations for why tinnitus can increase in volume. Most of them are treatable, or if you have a sudden change, we should get a hearing test to rule out something medical, something physically changing. And then once that's ruled out, then we can focus more on these retraining style approaches. Yeah. So that's what I was thinking. We have a question from William. Dr. Ramsey, would you like to take this one?
Which one is it?
Oh, on the
Oh,
screen
the
here, do you see
Rexton.
from William? Yep.
Okay, I had Rexton hearing aids, and it helped me get by tinnitus shock and CBT, and the masters helped me in a big way. I started dropping the volume down and weaning myself off the maskers. Well, William, that's great. This is all good news. It sounds like you used the amplification from your hearing devices. You had the masking program. You combined in cognitive behavioral strategies, and you are able to get a reduction in your tinnitus, and then
And then we
slowly.
have
So this goes
and
along
there's
with
a
what the
follow
sorry.
there's a follow up from William as well on the
Oh,
screen.
I didn't see that. Okay. I was just going to say, wow, that's great because that goes along with what that other question was. Do I have to do this forever? And the answer was no. And William's an example. So then William follows up with, I'm still here, the ringing. I still hear the ringing, but it doesn't bother me as much as for tinnitus volume dropping. That would be nice. Will sound therapy help hyperacusis? So like we touched on before, that volume, sometimes it's the last thing that we see a reduction in, but it looks like you're on the right path. Maybe not stopping the sound therapy just yet. Maybe try not weaning off just yet. I guess I would be if I saw you in person, I'd be able to ask a lot of clarifying questions on this one. But maybe it's too soon to wean if you're still thinking you might be able to get that volume to drop. Ben, if you'd like to take the sound therapy help with hyperacusis.
Yeah, absolutely. Sound therapy absolutely helps hyperacusis. There are many cases, a majority of cases, where hyperacusis goes to zero. It's treated completely. And those cases are real. Using sound therapy ear level is what I would recommend if you're trying to fully treat hyperacusis. Otherwise, reach out to an audiologist on our team and we'll be able to walk you through that. But yes, sound therapy does help hyperacusis, and it can make a dramatic change to it if it's done properly. Well, guys, we're going to wrap it up here as we're doing this live stream for about 30 minutes. So we want to thank everyone who's been here. And for those who are interested in speaking to an audiologist, you can find us at treblehealth.com. I'm also going to put an image here on the screen, which is our 2022 tinnitus guide. So if you are looking for all that can be done regarding tinnitus, etc., then this is the place for you to go. It's a free guide. You can download it from our website, or you can check the description of this video to learn more and have another resource. Thanks for having us. And Dr. Ramsey, a special thanks to you for being here and sharing your knowledge.
Oh, thank you. Thank you. And thank you, everybody, for the excellent questions.
Okay. Goodbye, everyone. Talk to you soon.